right, good morning everybody. Thank you very much for joining us on Women's View this morning. We're excited because it is the first day of a new month, that is December. And yeah, we were grateful to see another new month, so hoping that you're grateful as well. And thank you very much for making time to join us. Now, the world has committed to end the AIDS epidemic by 2030 as part of the Sustainable Development Goals. And this ambitious yet wholly attainable objectives, of course, represents an unparalleled opportunity to change the course of history forever. Something our generation must do for the generations to come. So listen to this message by Michael Sidibe, Executive Director of UNAIDS, and then we'll be right back with more on the topic of discussion today. Take a look.
On this World AIDS Days, let me start by saying thank you. Thank you to all of you. Thanks to global solidarity. For the first time, we can say that we break the trajectory of this epidemic.
By reducing the price of the medicine, by putting 15 million people on treatment, by having the hope that we can have a new generation free of HIV. But the job is not done. If we stop, if we don't continue to work, unfortunately, we will have a rebound in this epidemic. We have millions of people who have been left behind. We still have 22 million people without treatment, and their life is hanging in the balance. We have millions of drug users who are hiding themselves, sex workers not knowing what to do. We need more compassion. We need a society which can understand that the right of each of them to have access to services is equal. It is a defining moment because we cannot afford anymore to keep AIDS in isolation. We need to make sure that AIDS is about social justice, is about global health, maternal health, child health. It's about human rights of people.
We need to fast track. We need to quicken the pace of our action,
and this will change the face of the world. Let us end this epidemic by 2030.
All right, very powerful message right over there by Michael Sidik. And of course, it's high time that we pass the awareness on AIDS so that we can end this global epidemic. And back to the topic of discussion today, that is obesity and weight gain. And of course, many low-income and middle-income countries are now facing a double burden of the disease. And while they continue to deal with the problems of infectious disease and undernutrition, they are experiencing rapid upsurge in non-communicable diseases and of course risk factors such as obesity and overweight, and particularly in urban settings. So what exactly are we supposed to do to curb obesity and overweight as well, especially in children? Right now we're seeing high numbers of children suffering from obesity as well. So that is what we want to discuss today, and of course give you some of the treatment options that we can touch on so that we can curb obesity. So we have an amazing panel today. But before you meet them, good morning, Evelyn. World AIDS Day. Do you have a specific message for, let's say, the people watching us right now?
Actually, I was looking at the theme of
this year,
which says the time to act is now.
It's now.
As we celebrate World AIDS Day, we have to remember the theme that the time to act is
actually now.
Yes, we have to be together with the victims, of course, and people who have AIDS, and also people who are stigmatized, with HIV and AIDS and all that, and also create awareness on what AIDS, HIV is all about. So people need to actually know how the disease, the syndromes, and everything gets to your body. So this is actually what was AIDS Day, it's all about. And we're so happy again about the discussion of today, obesity. It's a taboo topic that people don't talk about.
People don't talk about it.
Yeah.
Like,
but we're glad to have the name is so unique. After she introduces herself, that's when we're going to catch the name,
Exactly.
So you'll be repeating your name I don't know how many times. So that
this morning we're actually trying to get the name right, but we will try and get it right. Okay.
Sure. So looking forward for the topic and to learn a lot, because people need to know about obesity. Now, when you look at someone and they're big, they're huge, you just say, you conclude that person is obese. But you don't know the reason behind that. So we need to know the facts and also the treatment of obesity.
All right. Okay. And of course, we have Dr. that name, okay? Lyudmilla Shchukina. Hey, okay. She's actually the doctor for East African Bariatric Clinic. Did I get that right?
Yeah,
okay. And of course, the founder of Ideal Weight and Healthy Living campaign, amongst so many other titles that, of course, she will give you as we continue with the show. So good morning.
Good morning.
It's such a pleasure to be with you today, so that we can talk about obesity and overweight, and of course, how we can curb, this menace that, like you said, it's a taboo. People don't really talk about it. So welcome to the show, and just say hi to the lovely people watching you back at home. Oh, say hi to the viewers.
Okay, hello.
Okay, it's an honor to be with you as well. Okay, and Esther, where have you been? It's such a long time, but you look well and healthy, and happy, and pretty as always. Thank you very much for coming as well. So just say hi to the lovely people.
Hi, everyone.
Okay, and of course we're also going to discuss about obesity. Now, doctor, let me start with you. What would you say is the prevalence, rate, not only in Kenya but globally, on obesity and overweight?
Maybe I can comment a little bit on that. What you said, that people don't like to talk about obesity issue. I was thinking about it. I was thinking like this before, but when I've seen Slim Possible program, Lilian Molly does not think like this. People like to talk about it.
Well,
ladies like to know about it, and they are open for it, and they are looking for the way out. So see, it might be a little bit mistaken thinking that people don't like to talk. People, I can say from my point, from the point of doctor, people always interested in their health. Obesity is health issue. And whatever topic about health, people like to know. People like to know the truth. What is this problem about? And whatever will help their health, people have very big interest in that. And I can say that people are shy about it. Or whoever my patients losing weight, some, they keep it privately, but many, they are ready to come to the studio and to present the result.
To talk about
and to show their picture, how they were before and now how they became.
After.
So this is, I see it like an open discussion, and I see as a discussion which very many people are interested. There was some time back I had, there is no single person who is not concerned about his weight.
Or their health. That's very true. And most people consider it as women problem, especially when it comes to the issues of the weight. Not everybody is comfortable enough to talk about it. Those who come out and say, "Man, I struggle with weight, and here I am today," are actually very, very few. And most people would say this is actually a women's issue. I mean, we don't really talk about weight. I mean, ask a woman their weight, and they will tell you, you do not ask a woman such questions, you know, and all that. So talking about obesity, and of course, like you said, people are now willing, you know, to talk about it as compared to back then, when nobody would even talk about their weight. And the fact that they're struggling, you know, with weight loss. And like I said, I mean, where would you say we are as Kenyans in terms of trying to really manage our weight and at the end of the day live healthy?
Where Kenya is at the moment?
Because there's no specific statistics on obesity.
Oh, there is a lot already. If we can say 15 years ago, there was not much statistic. But still, Kenya Demographic and Health Survey report is showing around 10%, 12% of Kenyans were obese and overweight. Now, statistics is showing terrible result. 55% of urban population of Kenya, in Nairobi population, have obesity and overweight. And it is it's not just a fantasy, this is the reality. You can easily see what is happening now in Nairobi. Like each second person has overweight or obesity. We are not talking about that extreme even obesity. We have a lot of super obese people, people with class 3 obesity. But so many people are having overweight already, class 1 obesity. So that is how it is starting. People are putting on weight a little bit and looking, oh, looks like I'm well fed, well, I'm doing well because I mean, you're putting on weight a bit, becoming reasonably round. After that, person keeping on growing. And that is where it is leading. It's leading to class 1, class 2, class 3, super obesity. It's leading to diabetes, high blood pressure, and all those diseases.
And we also have a World Health Organization. You know, it's a worldwide thing that gives facts and figures of people who are obese worldwide. So, and we're having the figures increasing from 1980 when they started their research and everything till up to date. So what do you think is the greatest problem when it comes to the worldwide rate?
The main problem, and it is proved, this lifestyle changes. If we can say in America started growing like 50 years ago. I can say obesity and overweight started growing in America for about 50 years. Europe for about 30 years. In Kenya, this problem is observed for the past 10-15 years. As economical situation is improving, as lifestyle changing, as people have more availability for food, is that what is leading to changes in their eating habit, and it's that what is causing obesity. That I can say even from that point, people did not manage to stand test for food. If before there was no food enough, like we can say, 20 years ago, or maybe 30 years, what about your parents, your grandparents, did they really had enough food?
I think there was enough food, for everybody. But I think most people back then used to eat healthy. Because right now, you know, if you look around, you would find that there's so many, fried foods, fast foods. We have hydrogenated fats and all that right now. But I think back then that was not the case, and I think most of that is why they lived much longer, because they lived healthy. And talking about obesity and overweight, most people would actually confuse someone who is bigger for being obese. So what is the difference between obesity and someone being overweight and someone being naturally big?
Oh yeah.
Obesity is body fat, but now the weight, overweight, there is from water that is in the body. We have got bones and muscles, so that is weight. But obesity, it is the fat the body fat.
Okay.
Generally, obesity, it is the accumulation of visceral fat in the body. We have subcutaneous fat and we have visceral fat. Fat which is accumulating in vessels, in liver, fat which is surrounding internal organs. So when patient's body mass index above 25, already we are talking about overweight. So overweight, it's not even, most of the people who are having overweight, they are not saying that they're having extra weight. They are like looking reasonably round, but this is already beginning of the problem.
Okay.
Then class 1 obesity, BMI 30. Class 2 obesity, BMI 35. Class 3 obesity, BMI 40 and above. Then visceral obesity we are assessing according to waist circumference. Maybe it would be interesting point for viewers to check, because it's very easy to check and it's very informative. Now this is the main indicator for central obesity, waist circumference. So you are just simply taking tape measure, and you put around your waist.
Okay.
So for the lady, it should not be more than 80 centimeters.
For the lady.
For the lady.
Okay.
For the man, it should not be more than 94 centimeters.
So that's a simple way of knowing.
It is simple, but this is the most informative. It's that what is recommended by all reputable medical organizations which are fighting obesity. Why it is important? Because the most important accumulation of fat in around the surrounding around the internal organs. So when waist circumference is growing, it means that visceral fat, internal fat, started accumulating. So it's a simple way to check. Before we used to check, still we are checking body mass index. But the most informative, waist circumference. If your waist circumference more than 80 centimeters, you started developing overweight or obesity. It's called central obesity.
All right. Now, is there a specific age? Like, for instance, for the BMI, we always look at the age and the height and all that.
Age we don't look.
Oh, we don't look at the age. Oh, okay.
Weight and height.
Weight and height. Okay. All right. And then let's say for the one that you're saying, you take
waist circumference.
Waist circumference. Okay. Is there a specific age? Like, let's say if you are 20. You're supposed to have like this centimeters if you're 25, if you're 50, or is it like common for all the ladies? It should not be above 80.
It is common for all ladies, all human beings. So when person is becoming older, why do we think that it's good to put on weight? Body is not becoming stronger.
Okay.
It's the opposite. Person should even take care of his health more, because already natural reserves of the body are somehow used. So extra weight, to carry extra visceral fat on your legs, to carry extra visceral fat which should be served by your heart, by your joints, by your lungs, by your kidneys, this is burden for the body. So normal weight, normal BMI from 18.9 to 24.9, and it is normal for all human beings, doesn't matter the age.
And for how long are you supposed to do the measurement? After how long are you supposed to be checking?
We are recommended once a month to check weight, to follow up.
And at what point do you look at someone and say, like, this person is obese? Because maybe someone might look at me and say, I'm not obese, of course, I'm skinny and all that. How do you identify someone who is obese?
Obesity is identified if person has body mass index above 30.
Okay.
Body mass index, this is your weight divided by height in meters square. So body mass index above 30, this is already obesity, class 1. This is already disease, and medicine is classifying obesity as a disease. Before we were talking like risk factor, now it's clearly seen that obesity is a disease. Obesity is a leading cause of diabetes. Obesity is leading cause for hypertension, heart diseases. Generally, it was also announced that obesity is a leading cause of non-communicable diseases.
Okay, before we get to talk about that, most of the time, or back then, people would relate obesity to rich people problems or rich people diseases because of course of the lifestyle and all that. But right now, we can see even from low and middle income families also suffering from obesity and all that. So how is that so? Because most of the time would relate to, let's say, the low income, like let's say they do not have enough food or they cannot access a healthy diet and all that. But how come they are still suffering from obesity?
Okay, first of all, I would like to say that obesity is now becoming a national disaster. And it doesn't matter whether you're eating well or you're not eating well, but what there is a way of eating. The way you chew your food, it can lead to obesity.
Oh.
Yes.
How so?
Because, the digestion starts from the mouth.
Okay, yes.
The digestion starts from the mouth. So if you don't chew your food nicely, you swallow them, then they settle.
Oh,
they tend to be fat.
Without chewing. I mean,
most of the people, they don't chew food nicely.
Chew your food very
In fact,
well
it's supposed to, when you chew your food, you chew 2 to 3 minutes. That is the way it's supposed to be.
Okay.
But how long do you chew your food?
Oh,
because the digestive system, the digestive enzymes, they're in the mouth. The digestion starts from the mouth. So if you swallow your food and it goes to the stomach,
they accumulate.
Settle.
Okay.
And it will tend to be fat.
Okay.
So chewing our food is also fast.
Very important.
Yeah, very
most people will be like, man, I do not have enough time to chew for 2
You just swallow like
Most people
it is
very
not
fast.
Right.
No, or you just chew take like 10 seconds or 20 seconds to your food and you're done.
So you'll say that now I eat well, I'm a good eater, but I'm still obese. It starts from the way you said. It is a program. How you chew your food, the time of your eating, what time do you eat? In fact, you're supposed to leave your food at around 6. The major food.
Okay.
From 6, you don't need to eat anything heavy.
All right.
You see, in most of the institution, what time do they eat their dinner?
They do practice that very well.
When you're in secondary school, what time?
As well. 5:30.
Yeah, after that time, you don't need to eat chapati, ugali, 2 kilos of chapati. You will still be obese.
And why do you think?
And maybe you will say that during the day, I didn't eat anything, now I'm having my meal.
You don't do
You
that.
have to.
And why is it hard for people to have that, practice that? Because of course, charity begins at home, and when we go to school, that's where we spend most of our time, and that's how we learn to do things the right way, right? So at school, like what you've just said, we used to eat at 6 and all that, but
And
when you
you
go
are
home,
It is hard. One thing, I think people doesn't love themselves. Because if you love yourself, you'll do the right thing. And most of the health issues, it's because we don't love ourselves. If you know that if I eat after 6, I'll be obese, why should you eat? And once you're obese, you'll get chronic diseases. The chronic diseases will be at your So why should you do that?
What's your take
We
on
don't
that?
have time for ourselves because we don't love ourselves.
Okay.
That's
Look,
what I love.
Esther, we can start a discussion on this. Is that what I'm discussing with my patients? Ron Slimming methods. You are noticing that people are doing exercises, they are not losing weight. Or if they are losing weight, they are gaining weight after they stop exercising. They are dieting, they are losing weight a bit after stopping dieting, they are gaining more than they were before. People are not eating after 6 p.m. They are trying to put so much effort not to eat after 6 p.m. But they cannot stand it for a long time. More they are thinking they're not supposed to eat after 6 p.m., more they are developing obsessive thoughts about food. What if person will eat before 6? Before 6, if person will eat 4,000 calories. And after 6, he will not eat anything.
You can eat fruits and
He
vegetables.
will not lose weight.
It's low in
He will-
calorie.
Okay. Now, talking about calorie, most of us don't really take time to understand the amount of calorie intake that we're supposed to take per day or even per meal. So, Doctor, can you educate us on how important it is for you to watch your calorie intake? And first of all, what is calorie intake? Because most people don't really know. I mean, at the end of the day, take my breakfast, take my lunch, take my dinner, and that's it. I do not have anything to do with calorie intake. So let's start from there.
That's right. You see, to narrow down our discussion to calorie intake, first of all, we need to talk about causes of obesity. Because obesity is not only calorie intake. Obesity is very complicated issue, obesity and extra weight. In obesity we have social causes, we have psychological causes, we have biochemical causes, and we have anatomical causes. Social causes manifested in the society where the person is living. Like few samples. Eating food as a method of socializing. When you see somebody is eating, you feel like to eat. When somebody is inviting you to eat, you feel like to eat. When you are visiting somebody and host is trying to host you nicely, he puts some food on the table, and even if you just had a good lunch, still what you do?
You just want to eat.
You eat.
Okay.
What is making you to eat? Influence from outside, so social causes. Or influence from TV, like I mentioned some time back. One mama is saying, my child does not want to eat anything except of that what is dancing on TV. So you can see there is an influence from outside which is influencing our eating habit. We have psychological causes, which are strongest. Psychological causes are those which are recorded. This is our eating habit. This is our subconscious eating settings, subconscious mind. That is our attitude towards food, our emotional connections towards food, our thoughts about food, our obsessive thoughts about food. So it is that what the person is developing since the time when he was born. So this is, we are talking about eating habit. Habit, it is that like habit for the child to suck the finger. How difficult to change this habit. When person is getting wrong habit, eating habit, it is also habit. Or drug addiction, it is habit. Alcohol addiction, it is habit. Smoking, it is habit. Or taking a lot of medications or painkillers, it's also bad habit. So the person is becoming like addictive from the food. Person has wrong subconscious eating settings, wrong psychological approach to, wrong thinking about food. So those are psychological factors, subconscious psychological factors, which are most difficult to deal with. Then we have also biochemical factors. Biochemical factors is there where we are coming towards, about counting calories, taking right nutrients. So here, that is where we are, that is where your question should fit, under biochemical factors in gaining weight. So balancing energy intake output, when person is taking more calories than he is spending, of course that extra calories will be accumulated in their body. There are other factors which are influencing on obesity, anatomical factors, like expanded stomach. For the person to feel satisfied, you need to fill up the stomach. Feeling of empty stomach, nobody can tolerate. Like there is a say, hungry lion cannot refuse rotten meat, or hungry person cannot refuse bread. If you are hungry, you will eat anything. Whatever you will buy mandazi on the road or chapati or whatever. You will eat even the West food, the least healthy food. So this is, we are talking about anatomical factors. Obese people usually are having, due to that previous their life, because they usually overeat. So stomach is expanded. So like size of your stomach will be different from the size of the stomach of obese person. So for obese person to feel satisfaction, he needs to eat much more food, and it is that what is leading to that person needs to keep on eating more and more. And it's that what is not allowing person to lose weight. So you can see 4 different factors must be taken into account when we are treating obesity. And now if we are coming to calorie counting, so it is one of the small factors which should be taken into account when we are treating obesity. Of course, if your amount of calories which you are spending during the day, 1,800, and you will eat 3,000 calories, even you will put on weight.
Oh.
You are slim, but you will put on.
Contribute to obesity. We have guys who love taking alcohol, like we've talked about drugs, so alcohol and nyama choma, and they love that so much. Then after a while, you start seeing the stomach protruding, enlarging, and all that. Is it also a factor contributing to obesity?
Very much. This is one of the questions which we had just on our symposium recently, which we had. Alcohol. Taking alcohol is making person to lose control over his eating habits, over his eating. When person is eating, person is drinking, he feel like to eat. So it's one of the contributing factor in obesity. So taking alcohol itself is reducing control over the eating habits. So person is eating more. And secondary, alcohol is reducing metabolic processes, biochemical processes in the body. So even when I'm working with my patient, I'm clearly, one of the points which I'm clearly stating that when person is taking alcohol, even moderately or whatever he used to, even not, I'm not talking about alcoholic, but anyway, if person is taking alcohol, he will be losing weight slower than those people who are not taking alcohol, because alcohol is slowing metabolic processes, slowing down metabolic processes in the body. So those who are taking alcohol, they will be losing weight slower than those ones who are not taking or taking less.
Okay. All right. And hey, talking about taking less alcohol, most people will be like, I will have like 3 glasses or 3 bottles of alcohol a day. Is that taking less?
See, alcohol, there are different people are taking alcohol in different ways, different amount. The thing is, when person is losing weight with the right method, generally all food is allowed in the method which I am using. Generally, all food is allowed. Even alcohol is allowed. How much person will take alcohol during our weight loss process, it will depend on him. But after we are going on with our work, after person is going through psychotherapy, which we are using psychotherapy of obesity, after person is becoming to know so many things regarding obesity, what I'm observing in my patients, they are deciding how much alcohol they want to take during their weight loss process, and even furthermore, taking into account that if they're taking alcohol, speed of weight loss will be slowing down. But still, what I can say that I had quite a number of patients, ladies even, who like to take a glass of wine in the evening. Since it is allowed. It is allowed, and even when they were taking this glass of wine, they keep it in their mind that their metabolism will be a little bit slower than if they would not take alcohol. But still, with the right approach, with right knowledge about obesity, they will be still losing weight. And this will be just personal decision how much they want to take. Very often what I can see, like if I have lady who came for weight loss, and some ladies are saying that they take maybe half bottle of whiskey on Saturday. Yeah, and or wine, or 3 or 5 beers. But when we start working with them, after they are becoming to know how alcohol is influencing on their body weight, they are very comfortably, without any problem. They are controlling, they are deciding how much really they want to take, because they were thinking it's not influencing on their weight. They were thinking it is just like this. But after they became to know that alcohol, it is calories. It's very high caloric food. So it's not just drink without any energy. Very, very high caloric food. Or about calories I can mention. And secondary, alcohol is slowing down metabolism. So 2 aspects which are influencing on a patient's weight. So what I see with my ladies, mostly ladies, men also, after they are becoming to know about influence of alcohol, they are deciding to take maybe 1 glass, but not full bottle.
Okay.
Individuals that are obese, and they need natural ways on how they can control that and also help them on that. So what's your take on that?
Okay, the root cause of everything is what you're eating. And with the natural way, you have to do everything, because you can't deal with one thing. You eat well, you do exercise, your metabolism should also be very much okay. The natural way, and then you say, what do you think? What do you think about yourself? What about your mind? Yes.
Your mind should also be.
Of course, what you are eating.
Okay.
Make sure from the mind.
Start from the mind.
Okay,
and to love yourself also.
Okay.
Because if you love yourself, you do
do
the
the
right thing
yourself
without even being monitored.
Okay.
Now you said when you were at school, you used to eat at that time.
Yeah.
Can you eat at 6 now and you remain the same?
Right?
Because you're not under supervision.
Yes.
Yeah.
But if you love yourself, you can do even better than that.
It's all about discipline.
Yeah.
Discipline yourself,
Yes.
and you get.
And you know, once we are aware about the dangers of obesity, it is the root cause of every disease that we see in the country. If we can do away with obesity, I'm sure there will be no diabetes, infertility, because most of them not conceiving is out of their weight, both men and women. And again, what else? Hypertension, most of the cancers, heart diseases, the arthritis, all of those things, they are caused by obesity. So if we can do away with obesity and be aware of how to do it, then we can do away with most. We can even ease our doctors' job. We isn't their work.
Okay.
And we also have obesity leading to non-communicable diseases.
Yeah.
And can it also work vice versa, like non-communicable diseases leading to obesity? Like someone who has diabetes, someone who has heart disease can also be obese.
No.
It all starts with obesity.
It is all the way around.
Okay.
Obesity is leading to atherosclerosis. Atherosclerosis is leading to heart attack, heart problem, cardiovascular problem. Obesity is leading to diabetes. Obesity is leading to insulin resistance. Pancreas is just simply not able to produce so much insulin as normal size of the body is requiring. If person's weight is supposed to be 62 kilos and he is 92, so already extra 30 kilos need to be saved, including pancreas. So pancreas should produce that amount of insulin which can digest that amount of food which person is eating. So obviously person is eating much more than pancreas can serve, we can say. Obese person is eating much more than slim person. So it means if something is coming to your digestive system, your body needs to process it. And pancreas is just not able to do it. For some patients, there are some studies which are showing even BMI 25 is enough for person to start to develop diabetes. Even overweight. Even there are other studies are showing one person from BMI 25, just overweight, just maybe 10 extra kilos. After person is reducing this 10 kilos, blood sugar is normalizing.
Okay. All right, and of course, we'd also want to know how stress contributes to obesity, and especially in children. I mean, how do you know that a child is obese? Of course, we'd also want to talk about that and much more. But we need to take a very short break right now. Keep sending your questions to 211-44, and of course, we'll try and answer as many as we can before we end the show. So let's take that short break. We'll see you right after.
Meant to invite Zachary.
According to health practitioners, the increase in obesity among the urban dwellers in the last decade is a worrisome trend that threatens to send health-related complications right over the roof of many Kenyan households. By controlling weight gain, among other unhealthy lifestyles, one is able to keep many ailments in check as well.
By now, statistics is showing terrible results. More than 55% of Kenyan urban population obese and overweight. So it made me to think, if we would start this campaign 15 years ago, maybe amount of people who are now obese and overweight would be smaller.
Obesity is fast becoming a health threat to more people today as compared to just a few years ago. More people are gaining extra fat around their bodies. According to Dr. Evan Jenga, a consultant diabetologist, many complications attributed to extra body fat can be avoided by simply being extra vigilant.
Exercise, eat healthy, walk as much as possible, all right? Avoid stress, and then do regular medical checkups. Once a year, check your sugars, check your weight, check your blood pressure, do your tumor markers, check whether you have any cancer, because you can have cancer for years without knowing. And these days, there are tumor markers that you can screen.
Faisal Abdallah, who had to undergo special treatment to shed off extra weight, is all smiles about his health.
When I was overweight, I had problem with my knees, with my back, breathing problem. Even my pressure was going up. But right now I'm okay.
Gone are the days when being fat was attributed to successful living. With lifestyle diseases on the rise, it behooves all to keenly pay attention to diet and nutrition, physical activities, social habits, and minimal stress levels as means to control extra body fat. In the process, knowingly and unknowingly, many can succeed in keeping several avoidable diseases at bay. Solomon Were, GBS News.
Well, so welcome back to Women's View. Quite an interesting topic you're talking about here, to enlighten you and also to help you, obesity and overweight. So I hope you've learned a lot from the discussion we had before. So we need also to learn about the treatment, just a bit of it, and also the prevention of obesity. And we were talking about all these factors that contribute to obesity. And can you touch on the treatment? Then we get the prevention, then we get to the treatment before we end the show.
Prevention of obesity is very wide topic. Prevention should be done through education of the public. Obesity issue is developing since the time when child was born. So we need to do a lot of education on the governmental level. Education of mothers. So mothers would know how to feed their children. Education of the public about that what is causing of obesity. So at least we will be able to prevent those who are in normal weight from gaining weight. Or we would help people who started gaining few kilos to lose weight.
So a pregnant mother who is obese is likely to give birth to a child
Yeah.
who is obese.
As well. And talking about children, sorry to cut you short, about children, before we went for break, of course, we had that concern from a viewer where they were like, so how do I know that a child is obese? And what is the recommended weight anyways for a child? Because right now we're always excited when we see, a very chubby child. So, I mean, how do you know that a child is obese?
There is a graph. There is a graph on which we are assessing whether the child is having extra weight.
Okay.
All pediatricians are having it. So pediatricians are using this graph.
Okay.
Yeah.
Okay, and suppose someone cannot afford, let's say, to see a pediatrician, let's say from age 1 to 5, okay, and of course we know that
usually I'm using that graph because for small children we are not counting BMI.
Okay.
It's not BMI. For children, teenagers already we can use BMI,
yeah.
but for small children we are using the graph.
Okay.
So from there we can see.
Okay, and Esther, how does stress contribute to obesity? Because we have some people when they're stressed they don't eat at all, and we have those when they are stressed
they eat.
That is the time for them to eat.
Yeah.
Okay, a lot. So how does that?
When you're stressed, sometimes you don't eat, and our body is a government on its own. So what it will do, it will announce to the other system there is starvation.
Okay.
So the fat will be produced maximum, so you'll still be obese. Another thing, when you're stressed, your hormone become imbalanced. So there will be hormonal imbalances that also can cause fat gain.
Well. Okay, yes. So don't think when you're starving that you're going to lose
when
weight.
You're starving, that is the worst, the worst.
Okay,
you put more.
Definitely put on more if you are starving.
Yeah, if you're starving.
Okay, so don't do that. Okay, let's talk about the treatment, doctor, on obesity.
When we are talking about treatment, first of all, we have to keep in our mind causes of obesity. Social, psychological, metabolic, and anatomic.
Okay.
Taking into account that our time is already almost over, just a short comment on treatment.
Okay.
There are no single tablet which can sort out this problem. So there are no medications for weight loss. That is accepted all over the world by doctors. Physical exercises are not, with help of physical exercises, we will not be able to lose and maintain weight. We may lose a bit after stopping exercises, we are getting back. Effective methods of weight loss treatment. We are using psychotherapy to control psychological and social factors. So we use psychotherapy for obesity. All patients who want to work seriously on their weight loss must go through psychotherapy of obesity with a reason to change those subconscious eating mind settings, subconscious thoughts about food, subconscious programming of person's brain about food. So we're using psychotherapy. This is quite specific treatment. So all patients must go through psychotherapy. Calculation of calories, it is automatically. So we have to make sure that person is taking certain amount of calories, that he is not exceeding very significantly that amount of calories which he is spending. But if person need to lose 5 to 20 kilos, psychotherapy calculation of calories is just excellent for this patient. We have excellent results with those methods. But when we have morbid obesity, class 2 obesity with diabetes, high blood pressure, it was already proved and it is accepted all over the world that bariatric involvement the most effective treatment of obesity in those cases. Okay. So bariatric treatment, after patient is going through bariatric surgery and he is losing weight successfully, diabetes is result in almost 90% of all diabetic patients. So 90% of all patients with diabetes, they are recovering from diabetes. That is Swedish study. 78% of hypertensive patients after effective bariatric surgery, after effective weight loss, recovering from hypertension. And so on, if you will be talking about other complications of obesity. So at the moment, it is accepted and it is proved that the most effective method of weight loss in morbid obesity This is bariatric surgery.
Okay, so how does that work? Bariatric surgery, how does it work to help the patients recover from obesity?
Bariatric involvement, this is minimally invasive procedures considered because they are done laparoscopically through the small instrument, 2 or 3 instruments. Doctor is inserting through the abdominal wall, and idea is to reduce size of the stomach. So this reduction of the size of the stomach is helping person to control eating habits. And it is that what is giving like 100% guaranteed result that person will lose weight. This result is not reachable with any other methods. As I'm saying, if patient need to lose up to 20 kilos, we can work with psychotherapy calculation of calories. But if person need to lose 40 kilos, 60 kilos, only bariatric surgery is that what can give us sustainable weight loss. Because what may happen? Person may lose weight with exercises, with diet and whatever, but that result person is not able to maintain. So most of the cases maybe you had when person is doing a lot of exercises, he is losing. But after that, he is gaining more than he was before. So it is really that what our practice is showing, that bariatric surgery is the most effective.
And when is someone recommended to have the surgery, and are there any side effects after the surgery?
Patient is recommended. So we can go according to the recommendations of International Diabetic Federation and American Heart Association. Straightforward recommendation: if patient has morbid obesity, class 2 obesity, and diabetes, straightforward person is recommended to do bariatric involvement. That is what will give us immediately excellent result. Person is recovering from diabetes, high blood pressure, all that. But some, of course, not all people are ready to do bariatric procedure, especially in Kenya, which is not, this procedure is not known. So there is another recommendation of Swedish scientists. If person with morbid obesity trying to lose weight for 6 months and he is not succeeding, this is the indication to go for bariatric procedure, to at least to advise person to go for the next step, bariatric procedure. So earlier treatment of obesity with bariatric procedures will protect person in future from complications, because longer person is remaining obese, longer he will have diabetes, more he will be developing different complications of diabetes, atherosclerosis, kidney failure, heart diseases. So interesting point here, like for example, patient has diabetes, patient have class 2 obesity. Already 15 years he is suffering from this condition. Already 15 years he is going to the gym. 15 years he is dieting. 15 years he's taking tablets for weight loss, and weight is not going. So it means blood sugar is still not controlled, despite of that he is taking insulin. So it means 15 years blood sugar, high blood sugar is already affecting body of this person. 15 years, it's long period. You can imagine how big harm already it's done to the body. So that is why earlier treatment of obesity in diabetic patient will protect him from complications in future.
And do you also recommend natural ways apart from doing the surgery?
Of course. The thing is that we are recommended, if person is not ready yet to take this scientific study and to be open for it and to fight obesity and to win immediately, I mean, straightforward method. I'm advising my patients to start with psychotherapy, calculation of calories. They may have a good chance to lose weight. Also, it is more difficult and chances are low for morbidly obese patient to lose 40 kilos, I can say, with psychotherapy, calculation of calories. But there are cases which are succeeding. Okay. Recent case, my case, which we presented on on the symposium, second symposium, which we had now, November 26th, Mr. Abdallah Faisal. When he came with he had morbid obesity. He had around 80 extra kilos. Automatically, according to the recommendations, this patient was to go for gastric sleeve resection. And that is what we said with him. He was ready already to do bariatric procedure. But the thing is, our bariatric surgeon was not around. He went to Sweden for the course of training, next training in bariatric surgery. So we decided we are starting with Mr. Faisal medical weight loss, and after doctor will come from Sweden, we will schedule him for sleeve resection. I started working with him with psychotherapy, calculation of calories, keeping in mind that this patient will still go for bariatric surgery. Okay. First month he lost 8 kilos. Second month he lost 7. Third month he lost 9 kilos. And so by now Mr. Faisal lost 57 kilos in half a year.
It's possible that you can still lose in natural ways.
It is possible with this strong psychotherapy, this specific psychotherapy of obesity. So with exercises, it's not possible because he did a lot of exercises. He finished even his knees. So that's the thing.
Okay, all right. And as we're finishing, of course, in relation to World AIDS Day, and of course we know when it comes to AIDS, I mean, our immune system is mostly affected, super low. So what are some of the things that you would advise people, to take into account in making sure that you eat healthy, you live healthy, and of course you also boost your immune system so that we can avoid such things as obesity and of course overweight as well?
Okay, now the message is people should eat well, boost the immune system to the highest level, take the formula of New Start, nutrition, exercise, water, sunlight, temperature, a lot of oxygen, and then rest.
Okay.
Once you take that one, you are good to go.
Okay.
Yeah.
All right. Thank you very much, Esther. Thank you very much, Doctor, for coming over today and sharing very powerful insight on obesity and weight gain. And of course, we hope that you've learned a lot from today's topic as well. So we'll see you next time for another interesting show. That is tomorrow. But for now, we need to say goodbye. Time is not on our side. I mean, we should have 1.5 hours of this show. But either way, it's a wrap from us. See you tomorrow. God bless and stay safe.